to Watura Finley and the team, the workforce team at the Mass League for organizing today's call, as well as working with our clinical team to stay on top of these very sensitive and timely issues. I also want to thank our partners at Krokidas and Bluestein, who I know work with many of you independently, but also support the work that we do here at the League, and Jennifer Gallop among them. We've had many friends at Krokidas and Bluestein support us in many ways, but Jennifer has been here and willing to help us with some of these emerging issues. I want to just level set us maybe before we jump in with some details. I am getting calls from many areas, healthcare related and others, asking me, what are health centers doing? What is the Mass League advising health centers to do? One of those calls came from a major media network just this week, that they're also trying to figure out if they should have their reporters vaccinated or mandating that they be vaccinated. You may have seen in the news this week that the Massachusetts Health and Hospital Association is advising its members, its hospital members, to mandate the vaccination of its healthcare workers. These are challenging subjects. And if you've heard me speak on this subject recently, as I've been asked this question, I tell them that we're trying to balance, of course, the spread of this pandemic and now this variant, with also the fact that these are people with jobs who live in very sensitive economic conditions, and that terminating someone or having them resign from working at a health center has implications for those families and those communities, which makes this an even more difficult conversation based on not only the populations we serve, but where our employees come from. I will just tell you that what I think is interesting is a survey came out yesterday that tells us kind of where we are as a country and where we are as a state. And I wanted to share that before we jump in. This survey, which was done by, and I'll tell you in a second, the organization was the COVID-19 Consortium for Understanding the Public's Policy Preferences Across States. So this was a national survey published on July 30th. And it says overall, 64% of Americans support a vaccine mandate, while 70% support requiring a vaccine in order to board an airplane. Additionally, 61% of survey respondents supported requiring children to get a vaccine in order to be allowed in school, and 66% backed requiring college students to be vaccinated to attend classes. In Massachusetts, the survey found that 81.1% of respondents in Massachusetts would approve such a mandate, a higher percentage of people than anywhere else in the United States. I say that as we get ready to kick off this conversation, understand that it's not an easy conversation. It is one that people are grappling with across the country, and it looks different depending on where you are in the United States, but it looks different depending on what communities your health center is located in, and the makeup and the hesitancy and the concerns and the issues that you may face with your staff in those communities. We're respectful of that. Hence why we're having the conversation today, and we thank you for joining us. I'm going to now turn it over to Jennifer Gallop.
Thanks, Michael. Just adjust my volume. It's great to have so many people that I know and have worked with over the years attending today. I wish that I could see your faces, but I know that you're there. As some of you know, K&B was founded over 40 years ago as a public interest law firm with the unique mission to support mission-driven organizations like you. Our earliest focus was affordable housing, and that quickly evolved into our health and human services practice, which was supported by our nonprofit, public charities, and tax-exempt practice, which also supports our charter schools. Today's presentation is focusing on our employment and civil rights practice, which has been there from early on. I head up the healthcare practice, working primarily with Tony Cichello, Emily Kretschmer, and Allison Lennon, who some of you know. Brian, who is presenting today, works with Paul Holtzman and also with Tony Cichello, who has healthcare litigation. We work collaboratively with the League over these many years, and we're very happy that Michael asked us to speak with you today about implementation considerations. Our goal here is to try to make your lives a little bit easier as you navigate this thorny topic. We know how overwhelmed you are. I'll now hand it over to Brian to give you an overview and start the presentation.
Thanks, Jennifer. Hello, everyone. It's good to be here. We're going to cover a few topics today. We're going to give a little bit of background, and pardon me, I hear there's a bit of an echo, so we're just tweaking the settings here. We'll be talking about considerations surrounding a vaccine mandate, clinical, operational, legal considerations. We'll be talking about exemptions for employees if you do move forward with a mandate. And then we'll be more broadly talking about practical and logistical concerns for implementing this policy, the when, the who, why, how. Then I'll hand it over to Jennifer, who'll be talking about some board concerns specific to the way your organizations are structured, and also HIPAA considerations that you'll face that some other employers who aren't also providers don't face. We'll then move into a Q&A session, and hopefully we'll be able to address anything that is on your mind that we didn't cover moving forward. The first thing that's going to sort of underpin everything we talk about today is this is unprecedented. We've just never as a country been in this situation before with a novel pandemic, vaccines developed so quickly within that while that pandemic is still ongoing, using a new technology that had never been deployed to a scale like this, and suddenly being in a position where just 6 odd months after vaccines were first coming out, we're in a place where in many ways, not that there aren't still barriers, but the vaccine is potentially available to almost anyone who wants it above a certain age, excepting children. So this is just a situation. We're in uncharted waters, just as to sort of point that out. The last time there was a major court case that was dealing with this sort of a situation is 1905. So there's been nothing since then that has sort of risen to this level. We're all sort of trying to figure this out as we go along. The big question on a lot of people's minds is, can you mandate a COVID vaccine? The answer is yes, with certain limitations, with certain requirements. The longer short answer is yes, you can require that employees who will be in the workplace prove that they're vaccinated so that they can be in the workplace. You do need to provide certain exemptions, which we'll talk about, but this is the real crux of how these mandates work. It's not that an employer is mandating that employees have to get the vaccine. They're mandating that only vaccinated employees can be in the workplace. That may be a bit of a distinction without a difference to the employee, but it does matter in terms of how these policies are structured and how you approach them. The better question then is really, how do we mandate vaccines? How do we mandate vaccinations if we're going to move forward with that sort of a policy? The background for this is a huge shift over the last month, even since we started talking about putting together some sort of presentation on this matter. Just in the last 4 weeks or so, we've seen an enormous shift from the clients we talked to, from people in the news, from what had been the sort of prevailing wisdom over the spring of encouraging vaccinations in employees, has now really moved to a huge shift. Every day, more and more people, more and more employers are announcing that they will be mandating vaccinations in some ways. Here, right in Massachusetts, MIT was one of the first out with an aggressive policy, but 25 plus other educational institutions, higher educational institutions in Massachusetts will have already implemented a vaccination requirement or will for this fall. Mass General and a large number of other hospitals and healthcare providers similarly have announced either that they're already implementing a plan or will be implementing one. Big national companies, Google and Facebook, have done the same. On the government side, the Department of Veterans Affairs has mandated or is rolling out a mandate for all of its providers. City of New York is rolling out a mandate for all of its city employees. We're seeing that sort of those sorts of moves come up all around the country, but there are huge variations in how these policies are being implemented. You know, some of them, like MIT, have an immediate requirement. As of right now, everyone at MIT, staff, students, if they're going to be in the facilities, needs to be vaccinated. Mass General has announced that at some point in the future, once the vaccines are given what's being referred to as full FDA approval, as opposed to emergency use authorization, which we will talk about in a minute. Once that happens, all employees will need to be vaccinated. Others, like New York, are requiring vaccinations, or if you aren't vaccinated, each employee will have to go through a pretty stringent testing regime with multiple tests per week to keep working. So there are different ways that people are implementing these mandates, but all of them are driven by the same thing: the spread of the Delta variant and the consequences of opening up across the country at the same time that Delta is sort of starting to spread, or has been spreading, but is gaining new prominence in communities here, where, you know, recent studies out of some cities, you know, in New York, Delta accounted for more than 70% of the infections. So this is really what's driving things. You know, businesses have liability concerns. They don't want their employees to get sick. They want to provide and have to provide safe workplaces, but they also have reputational concerns to consider. You know, nobody wants to be known as the place that Delta really exploded in Massachusetts. You know, you can consider the way people have been talking about Provincetown and how that's become sort of associated with a huge Delta outbreak in the last few weeks. You know, that's certainly not good for a tourist location, but it equally isn't good for a healthcare provider or a school or anywhere else. So what's all the fuss about the EUA, the Emergency Use Authorization? All vaccines, all the 3 COVID vaccines in the United States have been approved by the FDA via the Emergency Use Authorization process. This is a relatively recent process within the last 20 years that allows the FDA to approve on an expedited schedule treatments for emerging diseases, emerging biological problems. You know, whether that be, Ebola in the mid 2000s, the early aughts, was one of the things that drove Congress to create this process. And basically what it means is the timeline for approval. There are still very strict requirements for safety and the amount of data that needs to be put in, but the timeline for approving a new treatment product is condensed. And as part of that condensed timeline, the FDA has to impose appropriate conditions on the use of an EUA product. Here, that's taken the form of the FDA mandating that COVID vaccine recipients be given a fact sheet with information about it and the EUA process. And included in that material is a statement that the recipient is free to decline this product that has been approved pursuant to an EUA. That's led a lot of commentators, a lot of people to say, well, you can't mandate that people have to get an EUA approved vaccine. That's just not true. The right to refuse is for the recipient as to the provider in terms of getting it. But like we said before, it's not that an employer who's mandating the vaccine is requiring the employee to get the vaccine. The employee is free to not get the vaccine. They just cannot be in the workplace unless they've met certain qualifications. And one of them is having had a COVID vaccine. As healthcare providers, you definitely are familiar with other vaccination protocols that certain healthcare workers have to meet in certain situations. Students have to have certain vaccinations to attend schools. This is really no different than that. And in fact, last week, the Department of Justice issued a legal opinion to the White House stating exactly that the EUA status does not prevent employers from mandating vaccinations. That said, there are still restrictions. Employers aren't free to act however they wish. They still have to follow other federal, state, and local laws, and we're going to run through some of those now. One other big consideration here, our conversation is really going to be about at-will employees. If employees you're dealing with are unionized or are subject to a collective bargaining agreement or some other sort of formalized employment agreement, you're going to need to look carefully at that to determine whether that sets additional restrictions. For instance, some collective bargaining agreements for unions specify exactly what vaccinations employees have to be in those schools, be in those workplaces. You can't just add one to that list as the employer without going through the negotiating process required by that agreement. So our conversation really about at-will employees. The first thing we're going to touch on is OSHA occupational safety requirements. Like all employers, healthcare employers are expected to perform risk assessments and comply with the general duty clause that all employers have to provide a workplace that is free of dangers that could cause, severe injury or death. More recently, after waiting for quite a while, more than a year, OSHA finally put out emergency temporary standards that are specifically COVID related. And these require covered healthcare employers to implement plans to identify and control COVID-19 hazards in the workplace. The full scope of these emergency temporary standards that's an entire webinar and a half, if not more. I just note that, you all, as part of complying with these standards, are going to be working up COVID plans. I'm sure you already have had COVID plans that have been put together over the course of the last year. And much like those COVID plans, any plan you have for mandating vaccinations is going to need that same level of thought of looking forward, of really looking at the specific conditions in your workplace, of your workforce, of the members of your staff, but also the community you're in, and how to address those concerns and keep people as safe as possible moving forward. The other big set of laws, and legal considerations that will shape your mandate is the equal opportunity laws. The EEOC has explicitly stated that, the federal equal opportunity laws do not prevent an employer from requiring all employees physically entering the workplace to be vaccinated for COVID, but employers still do need to comply with the Americans with Disabilities Act, Title VII of the Civil Rights Act, and other equal opportunity and fairness considerations. For instance, you need to make sure that whatever you're mandating, whatever policy you adopt, is applied equally to all employees. You need to make sure or consider and take efforts to ensure that your policy isn't going to have a disparate impact on certain protected classes of employees based on how you're implementing it. And you'll need to provide reasonable accommodations based on disability or sincerely held religious belief. Employers we also advise you to treat pregnant workers as if, through an exemption and accommodation process as well. Developments about interactions and recommendations between COVID vaccinations and pregnancy are coming fast and furious. I'm pretty sure 2 new statements and sets of guidance have come out since even we were finalizing this presentation over the last few days. I know some trade organizations are now actually recommending the mRNA COVID vaccines for pregnant women because the impacts of COVID on pregnancy are considered to be far, far more potentially dangerous than the vaccination potential side effects. Putting that aside, we do recommend at this point that you, even though federal laws and some other laws may not require it, that you do come up with a policy for employees who are pregnant for seeking exemptions or making accommodations as well. You also need to maintain the confidentiality of vaccination records if you are requiring proof from employees of vaccination. Pursuant to the ADA, you'll need to store these records separate from your normal personnel records. You may likely already keep some sort of vaccination records for at least some of your employees, keeping those separate from their normal personnel files. And if you are requiring proof of COVID vaccination, you can just slot it into that same, that same set of vaccination files, or something else that is kept separate. Two types of exemptions that are really going to come here, and you've certainly heard these being talked about. The first is not simpler, but it's a bit more clear cut. This is for disability, a medical condition under the ADA. Some employees can't get vaccinated due to health concerns. And the way this really works is that, if an employee comes to you, it's on the employee to come to you and say, I need a reasonable accommodation for this requirement. You can generally require employees with disabilities to meet the same general qualification standards, but unless, here in this case, unless there's a direct threat, a risk of substantial harm from not holding those people to the same standards. The EEOC has been very clear that COVID in the workplace is considered a direct threat. So the real question here, once someone comes to you and says, I need a reasonable accommodation because I can't get the vaccine because of a disability, because of a medical reason, the real question is, can you make a reasonable accommodation for them that, given the realities of your situation, on the ground conditions, that will address the direct threat that having an unvaccinated person in that space would present, that doesn't present undue burdens to you. So for instance, this could be increased PPE requirements. We've seen that come up a lot in past situations for healthcare workers who can't receive a vaccination that would otherwise be required, that they be required to wear full PPE, masks, face shields, other appropriate PPE based on the situation. That might work here for some people. Telework may be a possibility, staggered shifts, changes to the physical work environment. We've seen this with dividers and shields that have been put up, ventilation. There's no one list of things that are okay and one that's not. In every case, this is going to have to be an individualized, iterative process where you talk with the employee and you work out what you can accommodate in the workplace while still keeping people safe. When you're implementing a mandate, though it is on the employee to come to you, I do recommend that when you are communicating to your employees about any vaccine mandate, that you make clear that you will be providing accommodations for this, and that they can come to certain designated people in your organization to raise those concerns. It's going to be very clear here, particularly about, when we talked about a little bit earlier about treating everyone equally here and the same. It's going to be critical to provide your employees who will be handling this process with clear guidance about how to move forward, making sure that they understand the nature and of this conversation, need to be flexible, to communicate with the employee to try to work something out. And that said, you also need to consider each employee on an individual basis. Just because some accommodation worked or didn't work for someone in another role in a different situation, you can't just roll that forward to other employees. Each person needs to be considered individually. Religious beliefs are a little bit trickier because, to some extent, there is no clear objective standard. With a disability, with a medical exemption, you can require documentation from someone's primary care provider about the nature of what's going on, and saying, because of X reason, this person can't receive the COVID vaccines at this point in time. There's no similar letter that you can get that says this person holds a sincerely held religious belief that would prevent them from getting the vaccine. It's by nature just going to be a bit messier, a bit more clear cut. But a few words of guidance here. It's sincerely held religious beliefs, and it's not enough for an employee to just be worried about vaccines or this vaccine or doubting the science. it has to actually spring from a sort of a set of religious beliefs that are truly held. And you can't simply look to the official doctrine of a given faith to the extent that's available, because the law does protect, idiosyncratic or differently articulated expressions of faith, regardless of, what an official statement may say. The EEOC has recommended that employers focus on the employee's motivation rather than the nature of the activity itself. Here, that would be vaccination. So for instance, a reasonably clear-cut case is an employee who says, my religious beliefs mean that the only medical treatment I'll accept is prayer. I don't accept any external medical treatments. Well, that's a sort of a universal motivation. The way it applies to the vaccine isn't vaccine specific. It's a sincerely held broader belief. You'll need to look a little bit more closely if an employee says, well, my belief is just that I can't get the COVID vaccine. Not that there isn't a possibility out there that someone may have a sincerely held belief there, but this is what we're seeing a lot of, and there's been a lot of concern about in the media. People saying, well, what if everyone who's opposed to a vaccination or is vaccine hesitant starts claiming a religious exemption? I mean, you can ask questions, you can look more closely, all the same things we just talked about in terms of a disability and medical exemption apply just as much here. It's a little bit more sensitive a topic in some ways. It can be a bit more fraught given the current political and social climate, but you can still ask questions and we'll need to make an individual determination. All of this aside, there are still tons of practical and logistical concerns that you're going to need to take account of. As Michael mentioned, there are structural and practical and social historical barriers or reasons for many communities to not necessarily be trusting or to be hesitant about taking this vaccine. The United States does not have the best history with vaccines and with providing medical care to all communities. And so there are lots of sources of vaccine hesitancy that you may be dealing with among your employees, among the broader community. There are also, I said earlier that most people can probably access a vaccine right now. Conceptually, there are vaccines that are available for people to get, but there will still be logistical concerns. You may have employees who don't think, based on their their pay, their schedule, that they can afford to potentially miss a few shifts if they have side effects upon getting the vaccine. It's also worth considering here as we talk about how to implement a mandate that it takes time to become fully vaccinated. It's 5-6 weeks at best for the Pfizer vaccine, an extra week for Moderna, and that's assuming you get a shot in your arm tomorrow. So once you roll out a policy, even if everyone goes out and who hasn't been vaccinated already and gets the shot that afternoon, you're still not going to be able to have people achieve that fully vaccinated status for at least 5 or 6 weeks. Key for all of this is clear communication, outreach, education. You're not acting in a vacuum, especially with the work you guys do, with the missions you have. Being clear with your employees, with those who may have concerns, questions, really embracing putting out a mandate for vaccination. It's about having a conversation and working towards where you want to be. It's not a matter of sending around a memo, letting everyone know, and then stepping back. Repeatedly, we see with clients, you're going to have employees are going to have tons of questions. Being clear about who from your organizations will be fielding those questions, will be listening, taking in what other people are saying, and coming up with responses is pretty important. As I said, again, no one size fits all, and you'll need to be flexible. Things change quickly. The way this conversation has changed over the last month due to the Delta variant is just one example. But as you're putting together a mandate policy, you're really going to need to think about and bake into it that things may change. And you need to be clear to your employees that while you may be adopting, say, a vaccination or test policy now, at some point in the future, if things change, you may need to switch to an everyone gets vaccinated policy. And you need to be explicit when you're designing the policy. If you are going to mandate, you need to be clear on the, the three big W's and the H: when, who, why, and how. Wrapping together everything we've been talking about, you need to be clear on the deadlines and how, and allowing employees time to ask questions, address concerns, to move forward, obtain the vaccine, and then actually become fully vaccinated. This is really all told a 2-month process. You need to decide whether all employees will be covered or whether only certain groups of employees will be covered. You can mandate only for certain groups. We've certainly seen some employers do that when there really are vastly different risks, between the different groups of employees. Some people might say, well, only patient-facing or outward-facing employees have to be vaccinated. But I would urge you, when you're thinking about this, to think about internal interactions, right? If, how separate really are groups of people? Are they sharing the same break room, the same hallways, the same bathrooms? We've heard and are hearing more every day about how much more transmissible the Delta variant is, and some of the conventional wisdom about time and space and distancing, we just can't assume is true here. Related to the who, you'll need to be clear about why when you're communicating with these employees. Why mandate? Why now? Why do we need to do this? And why are you taking the steps you're taking? Finally, how? If you're implementing a mandate, you need to be very clear on how status will be monitored, whether you'll be requiring employees to provide you proof that they've been vaccinated, or whether you'll be requiring an attestation from them for them to sign a piece of paper saying, I swear that I'm vaccinated. You'll need to think through how the records will be stored. If, again, as we mentioned, if you're collecting that medical vaccination record, that will need to be treated confidentially. You'll need to work out the process for how employees will seek exemptions, who will make those decisions, and how you'll ensure they're consistent and fair. And then you'll need to figure out the enforcement mechanism. The difference between a mandate and a recommendation is if people who don't comply with the mandate, there is some form of consequence. You'll need to be clear on what that result is and communicate that upfront to employees at the beginning of this time frame, so there are no surprises 6 weeks, 8 weeks down the road when the policy comes into full effect. Will excluding unvaccinated employees without an exemption from the workplace, will that lead to their termination? Will that result in unpaid leave, a certain amount of time of unpaid leave, where if they don't still can't come into work, they'll be terminated? These are what you need to think about. There's no point in having a mandate if it won't actually change anything. It's just a policy, and that invites charges or allegations of unfairly applying it. So there's no point in having a policy that's not actually going to be enforced. You also want to think through what sort of information you'll be providing to other stakeholders in your community. How you'll communicate to patients who are concerned about provider status. It certainly may address concerns if you can, put up a little sign or communicate to all your patients that 100% of our providers are vaccinated. That may not be the case, though. And so you'll need to figure out, how you want to deal with questions or concerns that are going to come in from external sources. You also just can't simply disclose and discuss the confidential vaccination status of all of your employees with each other. But you should be prepared for colleagues who are concerned, who say, I want to make sure that the people I'm sharing a treatment room with or an office with are also vaccinated. And we've also talked about, we talked about in terms of exemptions, but you also want to consider, whether the mandate is right for you, knowing that you'll need to actually enforce it, or whether, you know, you want to say you're either vaccinated or, and then consider alternatives like testing regularly, like providing and requiring PPE for all providers or workers in certain spaces. You know, these are all things that you'll need to talk about and think about given the context of your own workforce, facility, the overall conditions there. Now I will turn it over to Jennifer, who'll talk about some CHC specific concerns, HIPAA concerns, and board responsibilities.
Thanks, Brian. I'm going to try to move through this quickly because I think I put it all in the slides, but we wanted to make sure that we address the league's question regarding what the board responsibilities would be in terms of adopting a mandate, making changes to other policies. There could be a variety of policies that are tweaked in addition to creating new policies as a result of this. So I've excerpted relevant sections from HRSA's Health Center Compliance Manual. And, you know, they kind of say the same thing, as you know, multiple times, which is why you all keep saying the same thing in multiple places to prepare for a HRSA survey. But the main topics are that you need to take steps to ensure that you are operating in compliance with applicable law. And so whatever that you're doing has to have that in mind. And that's also why the EUA considerations that Brian was talking about are so important. You have to follow your own policies and procedures, your own governing documents, and those governing documents are supposed to ensure that you have adopted, that the board is in charge of establishing policies, of refreshing policies, of updating policies, and approving them. Whether if they can't be approved in advance under an emergency situation, they can be ratified after. Can do the next slide. So, you know, if you were to sum it up, you know, the board should be involved in this entire process, and it should ensure that it's not doing anything that is inconsistent with whatever HRSA may come out and say. You know, there could be something at any moment, we don't know. While the EUA is in effect, definitely it's important to have board approval before enacting anything to make sure that you're checking all the legal boxes that Brian talked about for implementation. If you need to act in between a monthly board meeting, or because it's during the summer and you're not having your regular board meetings, you can act through your executive committee. And if and once the vaccine is no longer experimental, it should be most likely added to your regular policies. There may be some additional policies related to it, but it should just become part of your basic approach, and that itself would need to be ratified by the board. Next slide. Thanks. So I wanted to just spend a couple of minutes talking about HIPAA, because there's always a lot of press regarding whether HIPAA applies or doesn't apply, and it's very confusing to a lot of folks out there. And it's different when it's taking place for employers like you who are actually HIPAA covered entities. One of the things that I am not 100% sure of is whether you have decided to, each of you may have been maybe handling this a different way, whether you're going to, if you are vaccinating employees and they're not currently your patients, if you're going to include them in, you know, make them a patient and include them in your regular electronic health record. My understanding is that I don't think many of you are considering doing that you're gonna kind of keep those separate. To the extent that you vaccinate non-patients. The other thing that I am not certain about is if you are, you know, all in one voice about billing for the vaccination administration. And I know that last week, Mass Health also said that you can bill for vaccine counseling, which is great. So that was a good piece of news. So I'm just taking the position for the purposes of this presentation that you are, vaccinating some employees who are patients of yours and some who are not, that you're keeping the records of employees who are not your patients in a separate vaccine file, and that you are billing where you're able to bill. So those are the assumptions that I made in terms of putting together these slides. They may not apply for you. So this slide is just the standard refresher of what HIPAA really covers. HIPAA is not just about private healthcare information. It's really about the transmission of electronic health claims, which is why I mentioned the insurance piece. Next slide. So the key questions here are, is insurance being billed, and which insurance, and is insurance being billed, or how is it being billed, if at all? And the second piece is the patient status. Next slide. So with respect to billing, to the extent that you have employees who have insurance and you've decided to bill, HIPAA clearly applies. This is just the standard case. If you have underinsured employees and you are seeking additional reimbursement from the HRSA Coverage Assistance Program, that would also be subject to HIPAA because you're still billing insurance. There isn't any federal guidance on the HRSA Coverage Assistance Program with respect to HIPAA, but in some ways it doesn't really matter because the claim is still going to be associated with an insurance billing. And then the last category, which is the interesting one, is for the uninsured. To the extent that you have uninsured employees whose insurance has lapsed, are you going to bill the HRSA uninsured program? HRSA has actually come out with guidance that says that they are not considered, that this would not be something that is subject to HIPAA. So to the extent that you have uninsured employees for whom you're seeking reimbursement, the records that you have separate with respect to claims and billing for those would not be covered by HIPAA. Next slide. Okay. So with respect to employees who are your patients, even if they're uninsured, the fact that these are your patients, you're going to be documenting the vaccine in the medical record. And that's just going to become part of the medical record, which is already subject to HIPAA because of your organization and generally. So for all intents and purposes, that information will be covered by HIPAA, in that location. But you could decide to keep the vaccination records of your uninsured employees who are not your patients separate from the records of your uninsured employees who are your patients in order to preserve that extra HIPAA barrier. But this is a very technical thing, and it may not be something that you really want to spend time on. I just wanted to make sure that people understood what is out there on this topic. Next one. So this is just a little summary of what I just told you, just said in a different way, so I won't spend time on that. And then the next slide. The last thing that I wanted to provide you is just another piece of federal guidance about if you have employees that have actually gotten their vaccine from some other source. Federal Health and Human Services also provided an FAQ on this topic. So I just wanted to add this to the list of other federal guidance that Brian already provided to you. I don't think in some ways it would really come up that often because I think most people are going to provide evidence of vaccination by showing you their card and not having to get information released from another medical provider, but the guidance is out there, so I wanted you to have it all in one place. Back to you, Brian.
Thank you. Thank you. So the sort of final wrap up before we get into some of the questions that have been submitted is you'll need a clear plan. You'll need to well document it, and you'll need to well communicate the what and the why and the how to your employees, and be very clear on how this will work going forward with your employees who will be administering this mandate if you do decide to mandate. You'll face concerns, some legitimate and some not, and you'll need to be prepared to have difficult conversations with your employees and potentially with members of the community. I think it's pretty critical, especially for you all, to link vaccine mandates to your mission if you're going to go forward. Your employees need to be vaccinated to provide the highest standard of care to patients and to ensure that the organization can continue to function regardless of what happens next. Just this morning, I was reading some nightmare stories out of some Louisiana ICUs in more rural parts of the state that have been completely overwhelmed at this point. And in fact, are having to turn away some patients because too many of their staff are out to be able to take more patients in. And also to remember that every organization and every employee is going to be different. While we tried to go over some of the general principles that we think should be guiding how you come up with a policy on the vaccine issue, you're going to need to tailor whatever you do to your organization, your needs, your employees. That said, we've got a bunch of questions that have come through. A few questions touched on remote work, and both whether to require remote working employees to be vaccinated or not. I would very much recommend against requiring an employee who has no interaction with the physical workplace to become vaccinated, because it misses out on that why. Why are employees required to get vaccinated? Because having COVID in the workplace presents a direct threat to other people in that workplace. And so that's, that comes back to that distinction that we've talked about a few times, where a vaccine mandate isn't really a requirement that employees obtain the vaccine. It's that only vaccinated employees be allowed in the workplace, because that's where you as the employer are exerting your control and have those responsibilities under OSHA. So if an employee is really never going to be in the workplace, if they are in fact wholly remote and located in Idaho or California or wherever, then there's no reason, no justification really for mandating that they receive the vaccine. That said, the policy is really for any employee who's coming into the workforce. So it's, they don't need to come into the workforce, but they may at some point. If someone who comes in one day a week, one day a week, a few days a month, they'll still need to comply to be able to come in on those specific days.
There's one question about stickers.
Right. There was one other about remote work. Saying, are you required to provide remote work? No, no. I mean, obviously, many jobs can't be done remotely, but again, this is really it's an individualized discussion. So if there's an employee whose job can be done fully remotely, maybe was being done remotely at some point during this pandemic, that it may well be a reasonable accommodation for them to be allowed to continue working remotely going forward until the situation changes. An employee may be able to work part-time remote to minimize the amount of time they're in the office, or they may be able to switch responsibilities around so that they're able to work remotely. But there's no overall broad requirement that employees who can't be vaccinated or won't be vaccinated must be given remote work opportunities.
There's a couple on medical backup, one about pregnancy and one about just general.
Right. Regarding documentation, this is the same as any other reasonable accommodation under the ADA. And so, you should already have a process for that. You'll just want to be clear about how it's going to be applied here. You'll need really a doctor or whatever documentation you normally require to say that this person cannot get the vaccine for whatever reason. I know there have been concerns expressed that doctors will write pretty much anything. But an example that I've heard a bunch of times is someone just coming to you and saying, I'm afraid of needles, I can't receive the vaccine. That wouldn't be sufficient. Someone coming in with a letter from their psychiatrist that says this person has a crippling fear of needles and other sharp objects. And so they can't get the vaccine right now until we find a way around that. But that's something you need to consider differently, because that one may be treated as may qualify as a mental disability. In terms of stickers, I would not recommend using stickers to make it easy. If you're mandating vaccines, it should be pretty clear who needs to be wearing PPE. But again, you're going to want to make sure that everyone knows that even if they've been vaccinated, they can still continue to wear a mask or whatever PPE they need to feel comfortable in their role. It may well be that all the providers or many of the providers continue to wear masks, continue to do whatever else they need to do, regardless of vaccination status. But I would certainly recommend against anything obvious, putting a sign on, a bright sticker on a name tag, anything like that that's going to call out someone's vaccine status and broadcast it to everyone else around them. A few questions about pregnancy. I would say, whatever sort of documentation you need, obviously to some extent it will in many cases not be a bit more obvious, but I would still, to keep things uniform, ask that someone have prevent some sort of documentation. Guidance for pregnant staff and staff who have concerns about becoming pregnant. For those who are pregnant, we are recommending at this point that you do allow for reasonable accommodations, exemptions. We wouldn't recommend that same thing for pregnant staff or people who are considering becoming pregnant, just because that's an almost infinitely bounded group, right? If someone is considering something in the future, that's not a reflection on the current state, the current interactions they're going to have with their colleagues and other people in the employment place.
Brian, let me take the two that I have. In terms of, can the dentist bill for vaccine counseling? So I haven't read the guidance that came out last week in detail. I know that Caitlin and I were talking about it yesterday, so she may know the answer. But if it makes sense to me that they should be allowed to. If it's not in the Mass Health Bulletin, that might be something for the league to act on. The second question was, if you don't bill for the vaccine, then the record is not HIPAA covered, and I would agree with that statement. Those were the only ones for me, Brian.
Some of the other questions we're seeing here. Is requiring only those who have not been vaccinated to mask? Is it discriminatory as some may be medically unable? I mean, then we sort of get into a recursive reasonable accommodations loop, right? You can say that our requirement is everyone needs to be vaccinated, and those who cannot be vaccinated need to wear PPE. And then if someone is in that latter group who can't wear a mask, you then need to go through their reasonable accommodation process for that as well. It may just be that person can't safely be in the workplace because of that. And a reasonable accommodation doesn't mean you have to do everything and anything at all humanly possible that person. It's a reasonable accommodation, and you can still, prevent direct threats in the workplace, and you can still, refuse to do certain things that would create undue burdens on you, but it's going to be an individualized analysis.
Two good questions about liability and about providing the testing for those.
Are they in the Q&A or in the chat?
In the chat.
So there's a question about the reasonable accommodation is weekly testing. That's something you're going to have to work out on that individual basis. If you have a different, if you have an overall policy that's either vaccine or testing, then that's one thing. Then you're going to come up and say, either we'll conduct the testing or you need to bring it into us. I think one thing you want to be really careful about, though, is putting costs on employees in terms of the way this may have disparate impacts, in terms of the way this may treat employees differently. Remember, getting the vaccine is free. So if it's either vaccine or something else, you're going to want to try to make sure that the something else isn't imposing a significant cost on an employee in a way that is going to be viewed as being coercive. So for instance, if you are going to generally allow testing to stand in, you're going to want to make that testing available and not, say, require employees to go out and be buying their own tests or to go to see their PCP twice a week, which would have significant costs potentially. I think we've addressed most of them, and I know we are quite late on time, but I think we will try to get some generalized answers out if there are other ones in here between these two that we haven't been able to get to, and please don't hesitate to reach out to us and to contact us if you have other questions. Thank you all very much.
Thank you, Brian and Jennifer. Appreciate you speaking with our membership today. And we'll send out the presentation. We'll send out the polling questions as well as a recording to this call. Any other questions, please feel free to send them to the league, and we'll make sure that our colleagues at Krokidas and Bluestein are able to answer those questions and get them back to you. So thanks everyone for joining.